Welcome to TalkTensors. Thanks for joining us for another deep dive into some pretty cutting-edge machine learning research.
Good to be here.
So today we're jumping into a paper that's, well, really relevant. It's about how large language models are being applied to medical diagnostics, specifically chronic diseases.
Yeah, and that's a huge area, obviously. Think diabetes, heart conditions, neurological disorders, things that need careful, long-term management.
Exactly. And getting the diagnosis right and efficiently is just critical. So this paper asks a pretty fundamental question. How well do different LLM tools actually perform when classifying these chronic illnesses based just on symptoms?
Right, and they focus on two specific LLMs you might have heard of, DeepSeek R1 and O3 Mini. It's essentially a head-to-head comparison in this diagnostic task.
It definitely highlights the potential here, doesn't it? Using AI to maybe boost accuracy, speed things up, and help clinicians make better decisions.
Absolutely. There's a lot of promise, but also a lot to unpack in how well they actually do.
Okay, so let's dig into the details. The researchers started by putting together a data set, a structured one.
Yeah, based on symptoms for various chronic diseases.
Right.
And they were careful about the sources.
Right. They used info from places like the Mayo Clinic, WebMD, the World Health Organization, HealthLink BC, and Penn Medicine too. Pretty solid sources.
Definitely. They outlined major categories, cancer, diabetes, heart disease, mental health disorders, that sort of thing.
And for each category, they listed about, 50 distinct symptoms?
Around that number, yeah. So quite detailed. Then they fed lists of these symptoms into the two models.
And these models are a bit different, right? DeepSeek R1 is known more for understanding, the nuances in clinical text.
It's trained on a lot of diverse medical literature, aiming for high accuracy in interpretation.
While O3 Mini is more about efficiency. Faster processing.
Exactly. Optimized for speed and maybe quicker support, often integrating more structured databases, so different design philosophies potentially.
So how do they actually test them? What was the methodology?
Well, they use standardized prompts. So each model got the symptom information presented in the same way, which is important for a fair comparison.
Makes sense.
And the task wasn't just what's the disease category, it was more involved.
Oh.
They had to classify the broad disease category, predict a single specific disease, give a confidence score, low, medium, or high.
Okay.
Suggest the next steps for the patient, just briefly, like 2 or 3 lines.
Yeah.
And provide some reasoning, also very brief. Again, 2 or 3 lines max.
So you get a much richer picture than just a single prediction. You see the confidence, the rationale.
Precisely. It allows for a deeper evaluation of how the LLM is, quote unquote, thinking.
And the scoring.
Yeah.
How do they measure success?
Pretty straightforward, actually. They looked at disease level accuracy. Did it get the exact disease right? Like specific type of cancer, not just cancer.
Gotcha.
Then category level accuracy, did it get the broad category correct? Like identifying it as a neurological disorder, even if the specific one was wrong. And then an overall accuracy, which was basically the average of those two. Plus, they tracked the distribution of those confidence scores. How often was it high versus medium or low?
Simple scoring. 1 point for correct, 0 if not.
Kept clear.
Okay, so
Yeah.
the results. How did they actually perform?
Well, there were some clear differences. DeepSeek R1 generally came out ahead in the overall metrics.
How far ahead?
It got the specific disease right about 76% of the time.
Okay, it's pretty decent.
And the category right 88% of the time, which gave it an overall accuracy of 82%.
82% overall. And what about its confidence?
That was quite high. It reported high confidence in, get this, 92% of its predictions.
Wow, 92% high confidence. That's
Confident. How about O3 Mini?
still respectable, but lower. 72% for the specific disease, 78% for the category. That averaged out to 75% overall accuracy.
75% overall. And its confidence.
Lower there, too.
Yeah.
It expressed high confidence in 68% of its predictions, still more often than not, but a noticeable gap compared to DeepSeek R1's 92%.
Yeah.
Interesting. But I remember the outline mentioned performance varied by disease type.
Ah, yes, absolutely. That's where it gets really fascinating. DeepSeek R1, for instance, was perfect 100% accuracy in classifying mental health disorders, neurological disorders, and oncology cases.
100%. That's remarkable. Any thoughts on why?
Well, one hypothesis is that the symptom patterns for those conditions might be perhaps more distinctly represented in the vast amounts of medical text DeepSeek R1 was trained on. Maybe clearer diagnostic criteria in the literature.
Okay, that makes sense. What about O3 Mini's strengths?
It also hit 100% accuracy, but in a different area, autoimmune diseases.
Oh, interesting. Because autoimmune conditions can be notoriously tricky to diagnose, even for humans. Lots of overlapping symptoms.
Exactly. So O3 Mini excelling there is quite noteworthy. Maybe its integration of structured databases helped in that specific complex area. It's hard to say for sure without looking under the hood more.
Were there areas where they both struggled?
Yes. Respiratory diseases. That was a weak spot for both models.
Oh,
DeepSeek R1 only managed 40% accuracy, and O3 Mini was even lower, down at 20%.
wow, 40 and 20%. That's quite a drop compared to the other categories.
It really is.
And like you said about autoimmune, respiratory symptoms can also overlap a lot, right? Cough, shortness of breath, could be many things.
Absolutely. It really drives home the point that these models are only as good as the data they learn from. If the distinctions aren't crystal clear in the input data, or if symptoms are inherently ambiguous, the models are likely going to reflect that uncertainty.
Which really highlights the significance here. It shows the potential, yes, but also the limitations. We're not talking about replacing doctors anytime soon.
Not at all. But you can definitely see the potential for these LLMs as maybe diagnostic assistants, tools that could help a clinician process symptoms, perhaps flag possibilities, maybe even surface relevant information quickly.
Especially for complex cases, or maybe less common chronic conditions where a doctor might not see them frequently.
Right. It could augment their expertise, potentially speeding things up or broadening the differential diagnosis. But validation and understanding the why behind the prediction are still huge hurdles.
Definitely. And that brings up ethical concerns too, right? Like bias in the training data.
Oh, absolutely. If the data primarily reflects certain populations, the model might perform poorly for others. Fairness is a massive issue. And transparency, the black box problem. Why did it make that prediction? We need explainability.
Plus patient privacy, KPI, GDPR. You can't just feed patient data into any model.
Exactly. And the study itself acknowledges limitations. The data set, while good, might not capture all real-world complexity, and it's purely text-based symptoms.
Yeah.
No imaging, no lab results.
Right. Multimodal diagnosis is standard practice.
Right.
And those confidence scores, they're useful, but still a bit basic. Doesn't tell you why it's confident.
True. It's a good starting point for reliability, but doesn't reveal the internal reasoning, which remains pretty opaque.
So it's a benchmark. A useful comparison showing promise, but also clear areas needing work before thinking about wide clinical use.
Precisely. Now, to really get where this fits, it helps to think about the history a bit. AI in healthcare isn't brand new.
Right, we had those early expert systems way back when.
Yeah, back in the, 70s and 80s, they were essentially complex flowcharts, right? If then rules trying to mimic a doctor's logic.
Groundbreaking for the time, definitely. But they were pretty rigid.
Very. You had to manually encode all the knowledge, and if a case didn't quite fit the predefined rules, the system often just, broke down. Couldn't handle ambiguity well.
Then came machine learning, which is a big shift. Instead of writing rules, we started letting algorithms learn patterns from data.
And suddenly, the explosion of digital health records, online medical journals.
Oh.
It provided the fuel the data needed to train these systems.
And then deep learning really took off. Neural networks with lots of layers.
Exactly, which turned out to be incredibly powerful for things like processing images and language. Natural language processing, NLP, became much more sophisticated.
And that's what really opened the door for these large language models in medicine, right?
Yeah.
Their ability to understand and generate text that sounds, human.
Totally. They can process patient notes, research papers, symptom descriptions in a way older systems just couldn't.
We've seen other studies using LLMs for maybe more common illnesses, right?
Yeah.
And people experimenting with prompt engineering to boost accuracy.
Yeah, there's been work on that. But this paper is interesting because it zooms in specifically on chronic diseases, which often have more complex long-term symptom profiles.
And it gives us that direct comparison, DeepSeek R1 versus O3 Mini on the same task. It provides a clearer snapshot of where things stand right now for these specific models in this specific challenging application.
It really puts the current progress and the remaining challenges into context within that broader evolution of AI-driven clinical support.
Okay, great context. So let's shift gears slightly to our novel notions segment. Thinking about this paper, what future research ideas does it spark? Where could we go next?
Well, one thing that really jumps out is how DeepSeek R1 aced, say, mental health, while O3 Mini nailed autoimmune. It screams specialization, right?
Like they have different strengths.
Exactly. So my first notion is, Why not build a hybrid system, something that leverages these different strengths? Imagine a kind of AI traffic controller.
Okay, how'd that work?
Based on the initial symptoms, this controller, maybe a metaclassifier, decides which LLM is likely best suited for this specific case. Symptoms pointing to neurological issues. Route it to DeepSeek R1, autoimmune flags, maybe send it to O3 Mini, or a version fine-tuned for that.
So you dynamically choose the best tool for the job based on the input.
Precisely. You could even factor in the confidence scores. If one model gives a super high confidence prediction early on, maybe that carries more weight. It's like ensemble methods in classic ML, but maybe more dynamic and specialized.
Combining strengths to get a more robust overall diagnosis. I like that. Almost like an AI consulting team.
Kind of, yeah. It could potentially improve overall accuracy and make the system less brittle.
Okay, that's a cool idea. What's another direction this sparks?
My second thought is a bit more adversarial, maybe, focused on finding the weaknesses.
Adversarial. How so?
Think about adversarial symptom generation. What if we trained another AI specifically to create tricky patient profiles? Subtle variations in symptoms, maybe uncommon combinations, all designed to fool or confuse the diagnostic LLMs like DeepSeek R1 and O3 Mini.
So deliberately trying to break them, or at least mislead them.
Sort of. The goal isn't just to break them, but to understand how they break. By seeing what kinds of subtle, tricky symptom sets cause misdiagnoses, we learn a ton about their blind spots, their biases, the patterns they over-rely on.
Okay. So you use the attacks to diagnose the weaknesses of the diagnostic AI itself.
Exactly. And that knowledge is gold. You can use it to develop better training methods, maybe incorporate those tough examples to make the models more robust. You could even build in defenses against these kinds of subtle misdirections.
And you could watch their confidence scores too, right? See if they become less confident when faced with these tricky cases.
Yeah, that would give more clues about their internal reasoning or lack thereof and where their vulnerabilities lie. It's about proactively stress testing to build more reliable systems, especially for edge cases or maybe underrepresented patient groups whose symptoms might not fit the typical patterns in the training data.
Fascinating. Using AI to challenge AI to make it better, both are really thought-provoking research paths stemming from this comparative study.
Yeah, they're just ideas, obviously, but they flowed directly from seeing the specific performance patterns and limitations highlighted in the paper.
And for anyone listening who wants to really get into the weeds of the original study, we have put a link to the paper in the show notes.
Definitely worth a read if you're interested in the specifics. It's a solid piece of research benchmarking these LLMs for chronic disease diagnosis.
Right.
Shows the potential, but also, the work's still needed.
Absolutely. Which kind of brings us to a final thought, maybe for our listeners to ponder. As AI like this gets more capable and integrated into healthcare, how is that going to change things? The actual relationship between doctors and patients, the day-to-day practice of medicine.
That's the big question, isn't it? It's something research like this forces us to think about.
It really does. Well, that's all the time we have for this deep dive. Thanks for joining us on TalkTensors.
Thanks for having me.